So, Dr. Nadia, I'm a little bit in shock right now. Как они бы смогли найти инфекцию, чтобы лечить человека до конца? Well, my tonsils were taken out when I was 3 years old.
Oh,
And they're unique and why they're unique. И почему вы считаете, что нельзя их убрать?
да.
Hi, my name's Danielle. And we met a few weeks ago, we met with this wonderful doctor, Dr. Nadia Garieva. She lives in Perm, Russia. And as I said in my post, she is a national treasure to Russia. She is a doctor, the head doctor at a clinic she founded called Lymphatech. And her mission in life is to make a difference in the lives of people and their health. She is a professor. She is a PhD. She has her MD. She has all of these things after her name that kind of solidify her expertise. But it's really the woman that makes her who she is, and her desire to love and to serve and to give. And so we're here again today because we are embarking on an adventure to do a 10, maybe more part series on the lymphatic system and the human body and how that affects you. And so after our first conversation and our first post to Facebook, we got some really great feedback. And so today we want to take it to the next level, and we want to talk about something that seems ordinary, but really has some other underlying implications. So I hope you'll stay tuned. I hope you'll post a lot of questions, and I hope you'll learn something new. So we're here today. I actually have just gotten back from Russia. I've come to the States to help get my kids settled. So Dr. Nadia and I are meeting, and our time frame is a little bit different, but we both have sunshine today. So as you watch this video sometime down the road, I hope your day is filled with sunshine too. Dr. Nadia and I are going to be talking about nasal congestion today. So let me just bring Dr. Nadia into our conversation. Hi, Dr. Nadia. How are you?
It's good to see you again, Danielle. I'm very good.
That's good. I'm glad you're good.
We have sunshine day too.
Yes, it's quite lovely to have a good day. It actually lifts your spirits, right? And especially in Russia where it's so far north and there's very little sun all year round. So as I was saying, I just got back to my house in Iowa, and we were talking the last time about continuing our conversation on nasal congestion. And I have to tell you, I've never paid attention to this before. And in the plane, we were sitting with all of our masks on, but after a while, some people took their mask off and just hung it to the side. And I can't tell you the number of people I saw sleeping with their mouth open, breathing with their mouth open. And I had never paid attention to that before, except for in my own life. I was telling you about how I was a mouth breather all throughout my childhood. And I was told my nose was stuffy, but I was told I just had allergies. And so my parents didn't know to do anything about that. But I had to teach myself to breathe through my nose when I was an adult. And so I'm wondering if we could talk a little bit about the reasons why somebody breathes through their mouth and not their nose.
To figure out what is happening with the nose, we need to look deeper. When we approach a patient, we usually separate etiologenesis and pathogenesis of the condition. The former relates to why it happens, the latter relates to how it happens. So we'll start with the last one.
Okay, so pathogenesis is how it happens in our body, but ethiogenesis is why it happens in our body.
Yeah.
Okay, perfect. So I understand that. So for our viewers out there, I have very little knowledge in the way of medical expertise. Most of what I do is when my kids get sick, I research it, I Google it like most people do, and I try to figure out what's the worst case and what's the best case. So in my situation, I was told I had allergies. I never suspected anything else. Okay, so what does a person do if they have allergies?
True. It could have been allergies. Usually, people think about flowers, cats, or dust. But you see, it's not their fault. So, how is nose getting soft that you cannot breathe freely? And you breathe with your mouth open. How does it happen that the nose becomes blocked? You cannot breathe freely because the air you inhale obviously can you freely through your nostrils and nasal passage. The passage of air is somehow limited. It is narrowed or even fully blocked.
Okay.
It is.
So it's fully blocked. So that's what happened when I would sleep at nighttime. My nose would be blocked, and therefore I breathe through my mouth, right?
Yeah.
Oh, okay.
It is all about inflammation. What is inflammation? Inflammation is a protective response of your organism to an external or internal threat. Inflammation involves immune cells, blood vessels, and molecular mediators. It is a mechanism of innate immunity. Inflammation comes with redness, pain, heat, some loss of function, and swelling. The very swelling leads to enlargement of the tissues, even the tissue in your nasal passages, thus causing the narrowing or complete blockage of nasal breathing. Inflammation is a response of the immune system. What?
Okay. So my nose was inflamed then when I was a child. And my allergies also are a response to my immune system. But, okay. But you said it's not their fault. It's not whose fault? It's not my fault, or it's not the allergen's fault?
It is not, because allergens are everywhere we go. There is always a reason behind overreaction of the immune system. And now we go to the why question. Now, why does inflammation happen in the first place? Inflammation actually is part of the way we were created. And yes, I believe both in size and in intelligent design by a creator. Inflammation can be acute and can be chronic. If our immune system works well, acute inflammation should generally resolve when the threat is taken care of by the lymphatic system. One of the threats can be an infection, for instance, bacterial, viral, and fungal infection. Inflammation involves many cells and molecules to eliminate the threat and initiate a repair process in the tissue through a series of biomechanical reactions. If there is no inflammation, there is no immune response. There is nothing to stand against the infection. So, inflammation is chronic. No. So, inflammation when chronic means it doesn't go away after a while. It's a sign that something is wrong. If it goes up and down all the time, or runs, or you went to pet, it means that something permanently holds the immune system in the state of alert. And it may be chronic infection.
Okay. So can I repeat what you just said to make sure I understand? So basically, my allergic reaction was my immune system, and my immune system. How was my immune system protecting me? It was the inflammation that was taking place in my nose. My nose was swelling up, right? And so the inflammation is the indicator that something else is going on. And it could be bacterial or fungal infection. It's some
viral.
Type of an infection or viral. Okay, so three things. Okay, because I'm very curious now. My mother, I was just given allergy medicine all the time. So allergy medicine doesn't solve my infection. So, okay, so I'm confused then. Why isn't the infection looked at?
Yes, infection is the reason why children get sick frequently, leading, for example, to sore throat, runny nose, and they often get sprays and pills like vasoconstrictors, hormones, and antibiotics to relieve the symptoms. By the way, here are 3 pitfalls to avoid. Number 1, never investigating what is the exact infection and doing proper diagnostics. Number 2, never finally eliminated the infections and holding to a symptom control. Number 3, removing the large tonsils instead of dealing with the infection.
Okay, I have another question.
Yeah.
I'm sorry, now I have a lot of
With
questions.
pleasure.
So, okay, this is for our viewers. So obviously we have a script, right? Because we want to include the most important pieces of nasal congestion for you. However, that being said, this is a conversation, and it's a conversation between the three of us, between Dr. Nadia, between me, and between you, our viewer. And so I struggled with allergies all of my life. And it's only as I've aged that they've gotten less. And my nose was stuffed all of my life. I mean, my parents smoked, we lived in a dusty home, all these different reasons, okay? But what I'm curious about is that my mother knew enough to take me to the doctors. She knew enough that because of my sneezing and because of the stuff that was going wrong, she took me to the doctors. But the doctor never investigated an infection. And so you said something, we have to have proper diagnosis. You have to eliminate
Yes.
the infection,
Yes.
right?
Yes,
And
right.
so, and then there's the tonsils. Well, my tonsils were taken out when I was 3 years old.
Oh.
My understanding was that my tonsils were not needed. And my understanding was that they were the problem. And so when I was 3, my mother was not an educated person. The doctor told her they had to come out. She believed it. She said, okay, let's take them out. I want my daughter to be better. So they took my tonsils out. But you just said the tonsils are unique and they're needed for us. Can you please tell me why they took them out? And instead of taking them out, what would you have done?
Oh, it's very simple to take out the tonsils. Very simple. Instead of treat. And our tonsils are very important organs for our immune system of the whole body. And we need to treat tonsils if they are not good instead of operating. And because it is an important barrier against of any infection in our organism. When we take out tonsils, we allow the different infections to attack our brain, our lungs, our bronchi, for example, and etc. Any organs we allow to attack. It is new diseases.
Okay. So, in your scientific opinion,
Yes,
the tonsils are
yes, it's
they're good for us.
Yes.
The tonsils are good for us. And
yes, it's very good organs, very good organs.
and the tonsils can be healed then. A doctor needs to find out the reason for the infection.
Yes, doctor need to know about infection. What's the reason of the bad tonsils, for example?
Mm-hmm. When
Doctor,
the tonsils are mad. I love that.
doctor need to know
That's
infection. Yeah.
Okay, so how does a doctor find out what's going on? Let's take me, for example.
Mm-hmm.
I'm 3 years old. I'm a little girl. I go with my mom to the doctor. The doctor says, oh, her tonsils are bad. They're mad. And we got to take them out. And so, and that wasn't a good choice. How does a doctor find out what's going on, what kind of infection a person has?
Medical doctors have to find the infection which attack tonsils, and medical doctors have to know the proper diagnostics. It's not simple way, but it's possible to find the reason, for example, the inflammation. And the reason of inflammation, as usually, is infection. For example, bacterial, viral, or fungal infection.
Okay, and how do you find out which kind of infection you have?
I'm sure American doctors know how to
Of
find the
course.
infection because
Okay,
I
I'm not
know
saying
how to
doctors
find
are
the
bad
infection.
anywhere, but let's say, for example, it's just an example. I come to you with my little girl, although she's already my big girl, so my granddaughter, and I
Uh-huh.
say, "Oh, Dr. Nadia, my little Lucy is sick all the time. Her tonsils are swollen, and we don't know what's going on." What tests would you do to find out?
It's very,
Where do you
yeah,
start?
understand. It's very simple, and I scratch the material from your tonsils, and I scratch the material from your nose, for example, and I have the material for investigating, and laboratory test give me the results. It's simple
Okay.
to find the infection. Because every patient in our clinic, it's regular practice for our patients in our clinic, regular practice on infection.
And is it a regular practice in Russia too? All of Russia to do that?
Not in every clinic, I think, but in our clinic, it's regular practice to investigate infections in patients.
So then what would be the reason to take out the tonsils?
In medicine, there are absolutely reason. For example, as for tumor of tonsils, just tumor, I think, just tumor.
So you would only take it out if there was a tumor.
Yeah, just tumor, and there is no another reasons, because in every case we have to treat tonsils, just treat. Absolutely, I'm sure in this way, because
So
it's
do
right
you,
way.
so then first of all, you would take your samples from the tonsils and the nose, and you would find out what kind of infection it is, whether it's viral or bacterial or fungal. Can you tell me a little bit about fungal infections, and how do fungal infections affect the nose, the breathing? What do they do? I mean, maybe I had a fungal infection as a child.
Maybe because fungal infection is the indicator of immune system, and when we test different infections and we can see fungal infections, we know that is very poor, that is very bad immune system, because fungal infection in your nose, in your tonsil, for example, this is indicator of the immune system, and
Of your immune system not working properly. Okay.
and
Okay.
when we come out, or when we take out tonsils, we have a compensatory mechanism, and we have tonsil called is adenoid. Do you know adenoid? And as a compensatory mechanism, the pharyngeal tonsil is enlarged. Usually they call it adenoid. It is now enlarged and again decrease the passage of air. So the wrong tactic is to knock it down too, making the situation even worse.
So the tonsils and the adenoids are different.
Pharyngeal tonsils is the same adenoid in the nose. We
Ah,
have
okay.
palatal tonsils in the pharynx and another tonsils in the nose. And when the palatal tonsils take out as a compensatory mechanism, adenoid tonsils is enlarged.
Oh, what does that mean?
And your breathing is absolutely blocked.
So you're
Because
saying,
because I don't know, it stops your nasal breathing.
oh my word. Okay. So I'm very sorry
can
that
breathe.
I'm slow to understand this. However, you're saying that when the pharyngeal, I think it's called, right? When these tonsils get taken out, this tonsil
Yeah.
gets enlarged
Yeah, yeah. Because it is
because
a
it's doing all
compensatory.
the work.
Because it is a compensatory mechanism.
Because
It's
it's
our nature.
compensating.
It's our nature. It's our nature.
Okay.
And one
Okay.
mistake after that another mistake, more mistake. Yeah. Tonsils are very important. Palatal tonsils are very important organs.
Gosh, I feel like I've been cheated. Somebody's cheated me. They've taken my tonsils. Okay. So now,
That is why tonsil react and hurt the first, because they accept any infection during the breathing. And when we take out the tonsils, another problem comes, come into
okay, so
organism.
you're just changing one problem for the next. So
Yeah.
we've also started to talk about like my favorite topic, which is overweight. We talked about being overweight. We've talked about hyperactive children a little bit, and we've talked about snoring as other topics that we want to include in our conversation. Um, so does the nose have anything to do with those?
To some extent, yes, it is very possible, depending on the case, of course. That is why we usually discover medical and family history. Actually, the list of possible ramifications is much broader than that. It can be bronchial asthma, headaches, pain, sexual problems, blood pressure, etc. Different problems.
And they all show up later in life. So the problems that we have as children, right, they kind of show up as you grow older.
Yes, yes. More and more problems with age.
All from a stuffy nose. Okay. So so how is all this interconnected?
Every is interconnected in the body. By the way, the lymphatic system is very much involved in the process. It is an infrastructure for immune system, for immune response. It cleans all the waste. Along the bloodstream, it serves as a highway for immune cells. It maintains every cell. It covers whole your body and links different parts of the body.
And all doctors know this, right?
Not all, I think. I'm not sure.
Okay. And because right now I feel a little heavy. I feel like, okay, if this is true, if the lymphatic system cleans out the waste, if it's the
Yes.
highway for our immune cells,
Yeah.
and if it maintains every cells, then we should know more about it. Like we should know, as a mother, I should have known more about it. Because I could have been kind of looking at my kids when they were sick a little bit differently than the way I looked at them. So that takes me back to the reason. So this is the reason you started the clinic.
Yes.
Was because you wanted to get the word out there, right?
Our knowledge was very main reason to open our clinic. It absolutely can. Nasal congestion is actually a good example to start talking about lymphatic system, because the lymphatic system of nose and throat are linked with our brain and linked with our lungs, for example. So I guess next time we meet, I will show you how does it look like and work, and we'll use this nasal congestion issue to illustrate it, so you can visually understand what is going on in case if you allow your nose to be stuffed all the time.
Okay. Well, I'm looking forward to the next time. So, viewers, when you're watching this, you're seeing a confused woman right now, because the information, like as I'm trying to put 1 + 2 + 3 together with Dr. Nadia, I am clearly understanding that I don't understand how the lymphatic system works. I mean, I don't know anything about it, but I don't understand. And I guess I just don't understand how medicine would take out your tonsils without trying to find the cause. And maybe it was just my circumstance. Maybe it's not. I don't know. But I'm really excited that we can go back to the beginning because I want to understand how the lymphatic system works, especially in my aging body. I want to live a long time, and I want to live well for a long time. And so as as we continue to meet together and to talk about this, I'm excited to see. When we talk the next time, how will you show me the system? How will you show all of us the system? Are you going to draw for us? What are you going to do so that we can understand?
Oh, I can draw some pictures, and I can show you the presentation about lymphatic system.
Okay.
I'm sure it will be very interesting for you.
Well, yes, I think it will. And for our viewers who are going to watch. So the next question I have, if our viewers have questions, I'm going to take these questions down, but is it possible that I could send you the questions in advance? And so we can include that as part of our discussion. Is that okay with you?
Yes, it's okay.
Perfect. Okay, that sounds great. Well, I've learned a lot today. And I'm sad that my tonsils are gone if they could have been saved.
I'm afraid so
Yes,
much.
but that was 47 years ago, so I'm not going to cry over it now. But it gives me some understanding. Well, thank you for your time today. I look forward to the next time we meet.
And thank you, Danielle. Thank you. It's been a pleasure. Have a wonderful day.
Thank you.
In your country.
I appreciate that. Yes.
See you next again.
See you next time.